We aren't the ones that called. The alarm being raised about this pandemic as fake news, that came out of the President of the United States' mouth. And no gaslighting is going to hide that.
House Oversight Committee held a hearing today on the federal response to coronavirus, where Dr. Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases, delivered a serious warning that the worst of the pandemic is yet to come. The testimony, however, was cut short, ending an hour and a half earlier than planned because President Trump summoned the witnesses to what Chairwoman Carolyn Maloney called a, quote, emergency meeting at the White House. One of the members of that committee who has denied her opportunity to question America's top public health officials is Congresswoman Katie Porter of California, who joins me now. First, let me just start on that. Do you have a clear understanding of what happened this morning and why that Oversight Committee hearing was cut short?
We were simply told that there was a meeting that they were required to attend at the White House. We do understand that the witnesses will be present again tomorrow at, I believe, 11 a.m. for the hearing to continue. And I'm looking forward to questioning them and continuing to press them on the administration's response at that time. You've
articulated two concerns. One of them has to do with what we were just speaking about in the previous segment about cost. In a letter that you wrote to Alex Azar, among others, it is critical that any cost barriers or limits to COVID-19 diagnostics testing be removed so those who may be infected do not forgo testing because of cost concerns. Is there currently any national policy or mandate that says anyone who is tested can do it for free? I'm really glad you're asking about this, because this is exactly what I'm going to be tackling with the witnesses tomorrow at the hearing. So I don't think I'm known for tipping my hand to the witnesses, but I really want them to get this answer right when I put it to them tomorrow at the hearing. There is an existing regulation already in U.S. law that provides during a public health emergency that the CDC can pay for treatment and examination and testing, all of those things. And so that's already in our Code of Federal Regulations. That's already one of the tools that has been at the disposal of the Department of Health and Human Services and the CDC this entire time. So I'm going to call on them tomorrow publicly to make sure that testing and treatment is free and that insurers pay their portion, but the American families are not left, that no American is left paying out of pocket or deterred from getting testing or treatment because of cost barriers. We have been trying in our own reporting, and I know others, to sort of track down what has happened with testing and the bottlenecks in it and the lack of capacity. I know it's a concern you have. Do you have a clear idea? Is there good communication from the White House about what exactly the precise status of it is and what the obstacles to scaling up are?
There's actually been a real gap between what we hear at these, what have now become weekly coronavirus briefings, and then what we hear when we go home and talk to families and constituents. Right. I had a telephone call this week, a conference call with hospitals in my area. They were all expressing that they don't necessarily have access to testing, that if they are sending testing in, it's taking days and days to get responses. One of the things that we're exploring is there's multiple failures in this testing process. One of them is not enough swab kits, not enough kits disseminated to the right locations and quickly enough. But one of the things that we do potentially have at our disposal is a lot of our research labs use the same equipment to do testing that is currently used in the clinical healthcare setting. So it may be possible to use some of those research laboratories at universities, for example, to do some of the clinical testing. But there's a process and some administrative barriers to getting through that. And so I'm interested in continuing to explore how can we bring existing resources to bear on this problem quickly.
Final question for you. You're a member of the Democratic caucus. It appears that some kind of stimulus package is going to be unveiled, I think, tomorrow by Democratic leadership. That's the indication we have. Do you have a sense of that, or do you at least have your own sort of principles and priorities from what you want to see out of a package tomorrow?
Absolutely. I'm going to be looking for something that's going to be putting families first, that's going to be prioritizing public health commitments. The House already passed a big bill last week, $8.3 billion. Those were the things that Dr. Fauci, in particular, who I think has been the most reliable administration official in terms of understanding really the science behind this and what we can do to save lives. We already did that last week. This week, we're looking to focus on understanding and protecting families who may be not able to get meals, dealing with transportation or school closures, trying to make sure that we're putting families first in this. This is not the time to be. The stock market will stabilize when families are stabilized, when health conditions stabilize, the market will respond. And so I'm disappointed that we have a president who's thinking more about the interests of special interests and big corporations than he is about the health care and life and death situation of our American families.
Congresswoman Katie Porter of California, as always, thank you so much.